name is Dr. SAEED REDA from Knowledge Eco Channel, and this is TEAS section. Our goal is to be a sheep, is to make practical videos to dentistry students. First course we will make is about conservative dentistry. Conservative means that we have a tooth and there is a caries on it. We will remove the caries, and this step we call it preparation, and we will put restoration on it.
In the beginning, we attempt to draw the outline form which resemble our preparation. We draw it for class 1 in the central grooves from the mesial fossa to distal fossa, and then we draw the other developmental grooves, mesiobuccal, distobuccal and lingual grooves, as we see in our preparation here. This our round bear. We choose small diameter 0.5 for gaining access in the central bit. Our purpose to make cavity with 1.5 millimeter. So first drill 1 millimeter, then complete it 1.5 millimeter in preparation. This our inverted bear. We use to extension of our preparation. We extended preparation right and left, and go in mesiobuccal and distobuccal groove, and then lingual groove. Continuing our preparation to remove all parts that we didn't remove in the first. Like this. This our graded dental probe we used for determining the cavity depths. As we see, we reached 1 millimeter, but this one doesn't what we want. We want 1.5 millimeter, so we'll use our inverted to make the ideal depth. Like here, we using our inverted, and we should make all the cavity depths, mesially, distal or the center depth, all the same, 1.5 millimeter. Containing our preparation, and here we using our probe to determine the depths, and as we saw, it's the ideal one, but needs some finish, small preparation to make the ideal depths 1.5 millimeter. And here we are seeing the grade. It's just the right one, 1.5 millimeter. We are just widening the cavity, not increasing the depth here. Here our fissure there, using for smoothing and making roundation for the walls, making converge buccal lingual and diverge mesial and distal. For the purpose of retention of our restoration, we will put here in the cavity. Here we make the diagonal converge. We go in one direction, not returning in the other opposite, for the purpose of making the wall smooth. Here making the mesial diverge, and here for distal making distal diverge also. Take a look here. Here smoothing the wall and make it round to remove all sharp points that will cause stress concentration that lead to fracture of our restoration. This is important. We must follow the principles of preparation to make a good restoration. And here we finished. Take a look on the shape, depth, width. Thank you and good luck.